Sometimes really people could have problems, significant problems, and they manage actually to continue to live the way they are living in terms of substance use or alcohol use for years. The fact that you are really still going to work and still married doesn't mean that you don't have a problem. It's like anything else, any other medical condition. Let us say diabetes. You might have diabetes and you are not really seeking treatment, and you could continue to function to some extent for a fair amount of time. This doesn't mean that diabetes is not actually destroying your body from inside. The same applies to alcohol or substance use. Oftentimes people ignore the signs that indicate that they are having problems with their alcohol use or substance use. The idea here is that if the substance use interferes with any major role obligation in life, whether at home, at school, or at work, this indicates there is a problem. Also, if the substance use or alcohol use causes any psychological negative reaction. For example, some people feel sad or depressed or behave in a way that doesn't really go with their values or goals in life. You might be using alcohol. It might be actually gradually, step by step, destroying your life with your loved one, with your friends, destroying your life at work. You might be actually losing opportunities to maybe get promoted or get better, but you just function at the basic level. They will see that the person is either having emotional problems, they are maybe withdrawn, or they look sad, or they look anxious. They tend to neglect their obligations, whether again at work or in life in general. They notice that they give up their hobbies, whatever they do. They notice that the substance use is consuming a fair amount of time of the patient's schedule, basically. First of all, you need to ask yourself whether you really need professional help. Usually that's the case when you reach level of use that's causing any kinds of problems that you really notice. I always tell my patients, you really cannot blame anyone for having an addictive disorder. Returning back to the example of diabetes, I don't blame anyone for having diabetes because it is a disease. I certainly blame them for not seeking help for that diabetes. Usually professional help is what is needed. The same applies to alcohol use disorder or substance use disorder, where you can really be blamed for not seeking that kind of professional help to help you and also to help those whom you care about, or even the society in general. By asking for help in issues like this, you are really providing a huge service to yourself and to everyone around you whom you care about.